I think the problem that we see, at least from the urology community, is that depending upon the sophistication of the urologist, depending upon the way a urologist or a urology group wants to get into specialization of care, it really can be a problem where the OAB patient may actually fall through the cracks. And what do I mean by that? In your typical community independent practice, especially in a bigger practice, you may not necessarily see a provider that has a special clinical interest in the thing that you're being referred for. So we know that patients, if they go to a larger community practice where there is no element of defined subspecialization, we seem to think that if an OAB patient goes into that practice as a first-time patient and does not see a provider that specializes in incontinence or OAB, there's about a 40% chance that that patient will not come back for a second visit. And I think people, especially, because I do believe that especially women, they do tend to present a little bit later. They think that this is manageable. If they don't get that feeling like this particular practitioner is interested more than that, they probably won't come back. However, we also know that if they do happen to see a provider that is routinely interested or wants to go beyond just here, take a pill, and really does do a good job in follow-up, the likelihood of getting follow-up therapies and follow-up appointments is much higher, north of 80%. So unfortunately, some of it starts from your very first visit.